I need you to stop scrolling for the next few minutes. Because what I am about to tell you could save your life. Or the life of someone sitting in the same room as you right now. My name is Dr. Christopher. And in my years of practicing medicine, there is one conversation I have had more times than I can count. A patient sits across from me, they look healthy, they feel fine, and then I show them their results. And everything changes in that moment. Not because cancer appeared overnight, but because it had been there quietly, silently, for months, sometimes years, and nobody caught it in time. That stops today, because the truth about cancer is this. It is not always the dramatic, sudden illness that Hollywood shows you. Most of the time, it whispers before it screams. And if you know what to listen for, you can catch it early. And catching it early is everything. We are talking about the difference between a conversation in my office and a conversation in an oncology ward. That is how serious this is. So let us talk about it the way I talk to my own patients. Honestly, clearly. No medical jargon, no sugarcoating. First, what actually is cancer? Your body is made up of trillions of cells. Every single day, old cells die and new ones grow to replace them. It is a perfectly controlled system. But sometimes, because of genetics, because of environmental exposure, because of lifestyle factors, or sometimes for no clear reason at all, one cell stops following the rules. It starts dividing uncontrollably. It ignores every signal telling it to stop. It grows, it spreads, it takes resources from healthy tissue, that is cancer. Not one disease, but over 200 different diseases, all sharing that same fundamental characteristic. Cells that have forgotten how to stop. Now here is what I need every single person watching this to understand. Cancer does not care how old you are. It does not care how healthy you think you are. It does not care about your diet, your gym routine, or your family history, though all of those things do matter for risk. What cancer cares about is opportunity. And the biggest opportunity it ever gets is when we ignore the signs it is sending us. So let me give you those signs. Right now, because I would rather you hear this from me than find out the hard way, unexplained weight loss. If you are losing weight without trying, without changing your diet, without increasing your exercise, and you have lost more than 10 pounds in a short period of time, that is your body telling you something is wrong. Do not celebrate it. Call your doctor. Sell it fatigue. I am not talking about the tired you feel after a long week. I am talking about a deep, crushing exhaustion that does not get better with sleep. The kind that makes getting out of bed feel impossible. The kind that has been going on for weeks. That level of fatigue can be a sign that your body is fighting something it has not told you about yet, changes in your skin. A mole that has changed shape, color, or size. A sore that will not heal. Skin that is yellowing. These are not things to ignore and hope will go away. These are messages: a lump or thickening anywhere on your body, under your arm, in your neck, in your breast, in your groin. If you feel something new, something that was not there before, do not wait 6 months to mention it at your annual physical. Call your doctor this week. Persistent cough or hoarseness. A cough that lasts more than 3 weeks, especially if you are coughing up blood, is never normal. Neither is a voice that has suddenly changed without explanation. Changes in bathroom habits, blood in your stool, blood in your urine, a sudden change in how frequently you go, or significant pain when you do. These symptoms drive people to the internet at 2 in the morning for a reason. They are the body's way of raising a red flag: difficulty swallowing, persistent indigestion that medication is not helping, a feeling of fullness even when you have barely eaten. These can all point to cancers of the digestive system, one of the most treatable categories when caught early, and one of the deadliest when caught late. Now I want to talk about something that nobody talks about enough on this platform: survival. Because here is the truth that the statistics actually show us. When cancer is caught at stage 1, the earliest stage, the 5-year survival rate for many of the most common cancers is above 90%. Above 90. That means 9 out of 10 people who catch it early are alive 5 years later, living their lives, watching their kids grow up, retiring, traveling, living. When that same cancer is caught at stage 4, after it has spread, that number can drop below 20%. Same disease, completely different outcome. The only variable is time. This is why I am on this channel. This is why I make these videos. Not to scare you. Fear does not save lives. Information does. Action does. A phone call to your doctor's office does. I have sat with patients who caught their cancer at stage 1 because they happened to watch a video like this one and recognized a symptom they had been dismissing for months. And I have sat with patients who waited, who told themselves it was probably nothing, who did not want to make a fuss, who were afraid of what the answer might be. The ones who did not wait are doing better. Here is what I want you to do right now. Think about your body. Think honestly about whether any of the symptoms I just described apply to you. Think about when you last had a screening, a mammogram, a colonoscopy, a PSA test, a pap smear, a skin check. Think about whether there is someone in your life, a parent, a partner, a friend, who has been brushing something off that they should not be, and then act. Make the call, book the appointment, go get checked, because the most powerful weapon against cancer is not a new drug or a clinical trial or a breakthrough treatment, though all of those things matter enormously. The most powerful weapon is you, paying attention, knowing your body, refusing to dismiss what your body is trying to tell you. I am Dr. Christopher. I will be here every week with real medical information that you can actually use. Subscribe so you never miss it. And if this video helped you, share it. Because somewhere in your contacts list, there is someone who needs to hear exactly what I just told you. Take care of yourselves. I mean that.